All right, I would enter the room. I would wash my hands, put my gloves on, introduce myself. My name is Byron. I'm your nurse. I'm here to do a postpartum assessment. Can you verify your name and date of birth, please?
Christina Anderson, 8/11/87.
I would match this with her wrist bracelet. Everything matches and is correct. I would put the bed up to a good working height. I would put the headboard down flat. It's also a good time to notify you that I have done my med-surg assessment and everything, all the findings was found to be within normal limits. I would also provide my patient with privacy by pulling the curtain. I would start my assessment with her breast. I would note that they are full and soft. Also, I would examine the areola and the nipples to make sure that they are not dry or cracking. After that, I would move down to her abdomen. The patient has a C-section. I would examine the C-section site to ensure that it's the edges are well approximated. There's no drainage, no redness, warmth, anything like that. This time I would listen to her bowel sounds in all 4 quadrants. Her bowel sounds are active in all 4 quadrants. I would ask the patient, when was the last time that you had a bowel movement?
This morning.
Okay, and everything was normal. There was nothing abnormal about it. At this time, I would examine her fundus by supporting her uterus with one hand and palpating her fundus with the other. The patient is 2 days postpartum, so the fundus should be 2 finger lengths down from the umbilicus, which it is. I would palpate her bladder, which I should not be able to feel, and I cannot. I would ask the patient, when's the last time that you voided?
A couple hours ago.
And was everything normal with that? No burning or anything, pain or anything like that with that? Okay. At this time, I would examine her lochia. There should be a moderate amount of rubra. Rubra is a darker color, and then it should go down as time goes on, educating the patient that it should go down from a rubra down to a serosa, which is a lighter color, like a pink, and then down to a alba, which is even lighter color. If that color ever goes backwards, you need to notify your primary physician. This time I would deglove, wash my hands, put new gloves on. Then I would move down to her extremities, examine her extremities, make sure there's no edema, no swelling, no warmth, which there is not. I would then examine her popliteal pulses, her posterior tibialis pulses, and her pedal pulses, noting that they're all present, strong, equal, and bilaterally. Then at this time, I would ask the patient and help her onto her side. From this position, I could examine the epidural site, make sure there's no leakage, drainage, redness, swelling, or warmth. Also, from this side, I could examine if she had an episiotomy to make sure that there's no leakage, drainage, or leakage, warmth, redness, and that the wound is clean, dry, and intact, and the edges are well approximated. Also, I examine if she has any hemorrhoids. If she does, what size. I need to know what size they are and how many they are. After this, I would roll the patient back on her back. I would deglove again, put new gloves on, and this is a good time to educate the patient about car seats. Do you have a car seat?
Yeah.
Okay, is it a new car seat or an old car seat?
No.
Okay, well, if you ever, a family member uses an older car seat, you need to make sure that it's not expired or been in a car accident, because the plastics could deteriorate on those car seats and it not be safe for the child. Also, when you're putting the baby down to sleep, you always place the baby on its back, no blankets, no stuffed animals, nothing like that, to help reduce the chance of SIDS. Also, when you're having a newborn baby, especially new mothers, it's easy to get aggravated with the baby crying all the time, so you never want to shake the baby. That could cause permanent damage and even death. So if that's the case, it's okay to just place the baby on its back, no blankets, no stuffed animals or anything like that, in its crib, and just walk away and take a break. You could also phone a friend, a relative, ask your loved one to come help and take a break. There is also there's 3 warning signs for the mother and 3 warning signs for the child that you need to contact your primary physician. One being a temperature of 100.4 for you. Also, if there's any pain in your incision sites, it goes from what it is right now to a more severe. Also, if your lochia If it, like I was stating earlier, if it goes from a lighter color back to a darker color, you need to notify your physician. For the child, a temperature of 100.4 again. If it doesn't have enough dirty diapers, it should be 6 to 8 dirty diapers a day. Or if the child refuses 2 feedings or more in a row, you need to contact your primary physician. At this time, I would deglove. I would retrieve the baby from the nursery and teach the patient about the bulb syringe. So I went and got the baby. I got the baby back in here. There's the baby beside of her. The bulb syringe, you always want to make sure that you depress it before you use it on the baby, because if you don't depress it and you use it on the baby, you're blowing air into the baby's face, which can cause it to choke. So you depress the bulb syringe, you start in one cheek pocket, and then you clean out the secretions. You go to the next cheek pocket in the middle, so forth, on into each and there, while cleaning everything out, depressing it in between each one of them. After this, I would ask the patient, do you have any questions? If she does not have any questions, I would lower the bed down to the lowest level, place the head back, the head of the bed back up to a comfortable position. I would place the call bell within reach of the patient and ask the patient, would you like to keep the baby with you or return the baby back to the, back to where it was before, back to the nursery.
I'm just going to send it back to the nursery.
All right, I would take the baby back to the nursery.